Our patient is an 18-year-old male hockey player who sustained a concussion 2 months ago after being checked into the glass. He experienced a 2-second loss of consciousness, brief retrograde amnesia, immediate dizziness on the ice, and 20 to 30 minutes of post-traumatic amnesia. He was imaged in the emergency department where the CT scan was negative. He continues to be symptomatic 2 months after his injury with complaints of headache, dizziness, imbalance, and cognitive problems. Symptoms get worse with any amount of physical activity or cognitive demands such as schoolwork. He's currently unable to participate in hockey games or practice due to these ongoing symptoms. So during the VOM screen, there are 5 different assessments that we will be completing. The first test we'll be looking at is smooth pursuits. Next, we will be testing saccadic eye movements, both horizontal and vertical. Third is near-point convergence. We will perform this examination 3 times and document the smallest distance that the patient is able to bring the target towards their nose. Next is going to be VOR times 1. We will assess this both vertically and horizontally, making sure that for both the patient flexes their head about 20 to 30 degrees. And lastly, we will be testing VOR cancellation or visual motion sensitivity and make sure that the patient is standing for this test. All right, so after performing our VOM screen, we found that our patient had impairments in both his VOR and visual motion sensitivity complexes. As a result, the intervention that we've chosen is going to not only target those systems, but it's also going to include an exertion component to increase the patient's level of activity and hopefully progress him towards 0 symptoms. Prior to starting the treatment, we do want to educate the patient about an acceptable level of increase in symptoms. So after the screen, Holden told me that he had a 2 out of 10 headache and 2 out of 10 level of dizziness. I've told him that if he gets above a 5 out of 10 in either of those symptoms, we are going to stop and take a rest break. You'll hear me periodically throughout the treatment asking him for just a check-in of symptoms to make sure that we're still below that level of 5 out of 10.
The patient will partake in a simulated hockey drill consisting of a vestibular and exertional component. For the vestibular portion, the patient will be required to read and state the names of 2 out of 3 hockey teams located on the whiteboard, those names being Abs, Preds, and Pens. Each is placed in a position so that he must rotate his head and eyes in the horizontal plane, thus challenging his gaze stabilization. He will also perform simultaneous stick handling while also jogging forward and backward to simulate gameplay skating.
Preds, pens, preds, pens, preds, pens, preds, pens, preds, pens, preds, pens.
All right, nice job, Holden. What level, 1 out of 10, would you rate your headache and dizziness level right now?
1.
Awesome. All right, so because of that, we're going to go ahead and continue with the activity. We're going to add in one more component. I'm going to kind of surprise Holden by tossing this ball towards him, and he's going to have the opportunity to just hit it and kind of take a pretend shot. Okay? So same thing, and then just be aware for me to toss the ball.
Preds, pens, preds, pens, preds, pens, preds, pens, preds.
All right, Holden, that was awesome. How are you feeling right now?
Feel okay.
All right, so symptom level, we're just going to check in again. How is your dizziness, 1 to 10?
I'd say probably 2.
Okay, and what about your headache?
2 as well.
Okay, so because of that, we are still okay to keep progressing the activity. Again, if we would get above that 5 out of 10 level, we would have Holden take a rest and monitor his symptoms to make sure they decrease back to baseline.